Hi, my name is Dr. Justin Davis, and today we'll be discussing rheumatic fever. Now, rheumatic fever is a rare complication that can arise from untreated infections called strep throat. Untreated strep throat infections. Strep throat is a disease caused by a bacteria called Streptococcus group A that can affect various parts of the body, but is most typically associated with throat infections. Now, again, it's a very rare complication, but when a child in particular has strep throat and it goes untreated, a couple weeks later, on occasion, the child may develop rheumatic fever. Rheumatic fever is not limited to children, although it's most common between ages 5 to 15 years old. It can occur really at any age in adults. If one develops rheumatic fever, the symptoms are typically a high fever, a rash. You may have swollen lymph nodes. These are the little glands that are located around the body, but particularly in the neck. There may be abdominal symptoms such as pain, and eventually these will go away, but a serious complication that can sometimes arise from rheumatic fever is rheumatic heart disease. And this is when, again, not for clear reasons, but there's some kind of autoimmune reaction that causes a deformity of the heart valves, which can lead to later on complications with blood flow of the heart. Now, because rheumatic fever is caused by symptoms of untreated strep throat, it's important to recognize the symptoms of strep throat. Strep throat often occurs in children, although it can occur in adults. It's usually a sudden onset of a very sore throat with swollen lymph nodes, those glands located in this throat, difficulty swallowing, pus in the back of the throat, high fevers, body aches. Usually with people with strep throat feel pretty sick. The treatment for rheumatic heart disease or rheumatic fever is that there really isn't a true treatment once these have developed, but to try to avoid this, you can treat the strep throat. Today in the United States, this is a very rare complication as we've developed antibiotics and have treated strep throat in children much more aggressively. Prevention, well, prevention with any kind of disease such as strep throat is always careful hand washing, but to prevent further complications such as rheumatic fever or rheumatic heart disease, if you have any suspicion that your child may be sick with strep throat, make sure to take them to their physician right away. There are ways that we can test not only for strep throat, but we can also test for recent infections with strep throat, and this will help us to diagnose properly and treat properly the underlying problem.